Hey, Dr. Shakib here from Irvine Spine and Wellness Center, your Irvine chiropractor, and I'm here with my wonderful John Dickinson. If you watched the series from last time, we had the first interview with John. John is an athlete, and he's going to give us a little bit of an introduction and introduce himself. But John is an athlete, and he's also a strength and conditioning coach, training other athletes. So we thought that it would be a good idea, being a sports chiropractor and John being an actual coach, being an athlete and a coach, we just thought that it would be a good idea to go over some of the things that I see as for people who are injured, and then John can show us some of the things he shows his athletes, conditioning him into doing their sports. By the way, the whole thing is going to come in handy if you're not an actual performing athlete, but you're an active individual, because you can't go wrong with that. So with that said, John, thank you so much for being here and giving us your time. If you don't mind, introduce yourself a little bit, and we'll go from there.
So like Dr. Shakib said, I'm a strength and conditioning coach. And one thing that I have had to move over is like a little bit from the strength realm into more of a get myself better realm, which is giving me a good perspective on both sides of how do I get someone strong, but not just reduce them to doing, some exercises that won't necessarily contribute to that. So yeah, that's kind of where I'm coming from right now.
You had posted something on LinkedIn. I think I saw that this morning, and I thought, right on, brother. I said, I don't know if you've been back on LinkedIn, but I said, John, maybe you should mention that. So this is a good opportunity to mention it. I thought that was, a lot of times people think that when it comes to sports, you just kind of bear the pain and you just push through and just do it. And the article that you shared with everyone was so accurate. So do you mind telling everyone what that was about?
Yeah, so like Dr. Shakib said, like most athletes, or at least athletes who want to get to that next level, the kind of persona they want to perceive is pain, no gain. If you're hurting, like suck it up, you got more work to do. If you want to get better, you're going to get hurt, you're going to break down. And there's some truth to that. You got to be a little tougher. You got to go to some places that other people don't want to go, because that's what's going to set you apart. But at the same time, maintaining our health is what's going to allow us to train harder, longer, which is going to get you there eventually. So if you just ignore these signals, ignore everything your body's trying to tell you, you're going to break down and you're not going to last very long.
And I think, to be fair to the athletes, I think a lot of times coaches are the ones who push people. And the whole goal is for the athlete to perform and to basically score. And a lot of times it's injuries that take for a long time to basically change that pathological pattern of movement, to prevent further injuries. So the article was actually talking about that very specific thing.
Exactly. Coaches, like you want to, me especially as a coach, I love squatting. I love these big heavy lifts. But as a coach, I feel like I need to get into the mindset where, I need to push them so they can, achieve more. But at the same time, I need to realize what I'm doing to them, realize what I'm telling them to do, and take the extra steps to keep them healthy so they can keep pushing harder and harder. So that's kind of what we're
And so they were essentially talking about the importance of the form when performing an exercise, and when it came to actually loading the moves, that at the very end part is when you actually engage the motor component, the motor, what do they call that? It's the motor unit, the main part of the muscle that's in charge of really pushing that muscle to perform maximally. And a lot of times they think that the more load you put on the joint or on the muscle, the better performance you get because of that, because it activates the motor unit. And that's not necessarily the case. So that study was specifically addressing that very issue. A lot of times you have to understand the biomechanics of movement in every given joint, and we're going to probably get sick and tired of it if you see this 12 series we're going to be doing in 2019. on different joints and different exercises. But you have to understand, if you want to get the maximum out of your muscles and your joints, and if you want to get the maximum performance, you have to be in optimal shape. We're not talking about strength, we're talking about biomechanics, we're talking about your form. So if, for instance, and since we're going to be talking about hip joint, it's a ball and socket joint, so your femur or your thigh bone, at the end of it has a ball that sits in the socket. The socket is part of your pelvis. So in order for it, meaning in this case the hip joint, whatever sport it is we're talking about, whatever performance it is that you're engaged in at the gym or not, this ball has to be centrated and has to be at an optimal position in order to perform the best. Look at it as a car will perform the best if it's factory designed and it operates as the factory design dictated. So you want to make sure that the joint is biomechanically in the best position, and then you go about and you condition it, which I'm so proud of John for as young as he is. The guy knows his stuff. So John, let's see how we want to format this, and by now we should have more people. I can see some people are online already, but how do you think we should format this? Should we first talk about injuries and then conditioning, or why don't we, I think it's probably best if you show us how to do the conditioning for the hip joint, what's necessary for the hip joint to perform optimally, and then if I see, as you're going about, if I see things that I see from the acute care, from injury point of view, and the things that I want to interject and say, hey, watch out for this specific thing, then I think that would be more interactive. We can give that a try and see how that goes, and then if people want to give us a feedback, that would be great too. If not, we're just going to wing it.
Yeah. No, yeah, that sounds good. One thing I want to mention before we start is a lot of this, I've formulated through research and listening to other peers, but a lot of it I've generated from a lot of conversation between the coaches at UCI, so I just want to give them, credit where credit's due, especially Coach Drew Mitchell. He's a basketball coach over at UCI. I love talking shop with him, and he always makes me think constantly. So I got a lot of this from him, So here we go.
I'm so proud of that, and I really think that this is a good time. You are very humble with the different things to do, and this is your opportunity to brag about yourself, because if you don't, I will. Why don't you tell everyone the number of sports that you have? Just what sports have you played? I mean, this guy knows his stuff from an athlete's point of view, and clearly, what made you decide to be a conditioning coach?
So in high school, I played 3 sports, basketball, football, and did track. In college at UCI, I just did track. One thing, I feel like I was adept at using all sports optimally, and that's what kept me a little more injury free for a little while, just like moving through these different planes of motion.
So it wasn't so repetitive,
exactly, it wasn't
constantly,
the same.
which is a big
exactly, yes.
deal
but
there.
As I started to gravitate towards track, strength is a huge component, when you're throwing objects. So I really gravitated towards the squat. I'm a little shorter, a little stockier. I have more of an aptitude towards squatting, and what people do when they're good at stuff, just keep doing it. You get better at it, you keep doing it. So it's a positive feedback. You just keep going. Unfortunately, I was kind of blind to the things I need to take in precaution to keep doing squats, which again is what made me come back here and reevaluate. Okay, I want to do squats for as long as I live. What do I need to do to foster that? And so that's kind of what led me here.
So I do know that you played those. You did shot put and discus.
I did shot put and hammer.
Hammer. I'm sorry. And then you also, right now you're doing, what type of athletes do you work with? Water polo?
So I work with...
he doesn't even know how to brag about the things he does.
So I work with the throwers at Arnold Beckman High School in Tustin. And I'm also working with the track team. I was working with water polo, cross country, and a few other sports at UCI with assisting the coaches that are there right now. Mostly helping them, keeping an eye out for good technique, good form, making sure no one gets hurt, and when someone asks me something, I can, tell them my opinion on it, where they want to hear it.
So, given the wide range of different sports and athletic experience that you have, is there any common pearl of wisdom that you can give for everyone that's watching, either an athlete, a performing athlete, or just an active individual that wants to avoid injuries? Is there anything specific from your point of view that would be like the pillar of performance that they need to watch out for?
Oh yeah, definitely is be active in your recovery. A lot of people want to just go to the training room and hammer me with this DMS tool or massage me or do this and that, the other thing, which, those things have their place and they can definitely help you, but the only person who's going to help you the most is you. You know where you're tight, you know where you're hurting. You need to put yourself in these positions to make yourself better. You can't just, especially with these movements I'm going to show, like you can't just, sit in a stretch for, 30 seconds out of your day when the rest of the 23 hours are going to be spent sitting.
Very true. I always say health comes in movement. So if you don't move, you're guaranteed you're going down the wrong track. And then the other thing is that you have to never ever sacrifice your form for the repetition or the load on the joint. And your posture is an absolute like a giveaway sign. If it's failing, if it's not biomechanically in the right position, you're just going to injure yourself. It's just a matter of when. So with that said, and I see that we've got more people watching, and I think that this is a good time to move on. When it comes to hip, so for one, just to clarify, this is hip. This is not hip. That's pelvis. So we're talking about hip joint. So pretty much every sport is going to involve the hip joint. And the hip joint's health, from your point of view, what are the associated areas within the body that go hand in hand with hip joint health and hip joint injuries, in your opinion?
So one thing that I've discussed with other coaches is the ability of the hips to be mobile, but with that you need stability. You can't have a super hypermobile hips and no stability, because then you're going to open yourself to injuries, because you're going to be exploring different planes of movement that you don't have control over, which is we don't want. And conversely, if you can't even get yourself into those positions, well, if you get into that position during your sport, say you're gonna, drive to the basket in basketball, and you don't have a good foundation or flexibility to get your hip open, you're gonna open yourself to injury just as likely. So with the hip, it has a certain amount of mobility that it wants, because it being a ball and socket joint. But with that, we need to, and if it doesn't have that, it's going to take that mobility and range of motion from other areas of the body.
That's so true. Hyperextension or hyperextension in the lower back, definitely inversion, eversion of the ankles, the medial lateral rotation, the turning of the knee in and out. Those are all you cannot have.
You can't, yes.
Lower or hip back issues without those, not hip back, hip joint issues without those being engaged.
Yeah,
very true.
Just like we spoke about on the last one, the whole body, it's not segmented in the sense that they work independently. It's all one unit, from your head to your toes. Like it's all supposed to work together, in conjunction to make you the best athlete or healthy individual you can be. So, specifically with the hip, that I've noticed is that a lack of internal and external rotation.
So, how about, since we don't know who's going to be watching this, we need to be kind of bringing it down terminology-wise, or say it, but then explain what internal and external rotation
So the ability of your feet, your leg to rotate inwards and outwards.
Inwards, internal, outwards, external.
Yes.
So this is internal rotation, this is external rotation.
Exactly, and so depending on what type of activity you are inclined to, so for me, for example, I like squats. A lot of, say, powerlifters or people who, enjoy squats, they kind of bias that external rotation a little bit more, because it's a little more advantageous to squatting. You have the internal rotation or valgus, it's not a very advantageous position to be in when we're performing the squat.
Plus, with a slight external rotation, you have a better centration, which is the positioning of your acetabulum, the ball part of your femur sitting in the socket. So you have more coverage of the acetabulum over the ball.
Yes, exactly. And then on the other side, I didn't have this issue because I don't like running, but people who love running, love long distance running, love things of that sort, which is it's great for you. They, on the other side, bias that internal rotation while they run, which is, not one's not better than the other, one's not worse than the other. We just want to have a good.
Neutral.
We need to be neutral. We need to have a good coverage over both ranges of motion. And so the first thing I feel like a lot of individuals I've encountered and for myself is to recover that if you like squatting, that internal rotation that you are deficient in, or the external rotation. And so that would be the first step that I would take them in.
So, so to assure that there is no internal external rotation of the hip joint, what are some of the things that we should be? I'm going to make sure when I post this video, if I can, I'll add the one. I really like foam roller over the IT band, which is over on the outside part of the leg. I'll make sure, at least I'll try to see if I can factor that into the video once I post it on YouTube. But I like the way I do it, and I think we talked about it last time, because it's not just rolling up and down, which I don't even know what that does other than torturing you. So it's more of a functional foam rolling. That I'll see if I can post it. If not, you guys can check out my YouTube channel for that. But so IT band for that. But what would you recommend for the vastus medialis, for the internal?
For internal rotation, trying to recover and get more external rotation, one easy way is just sit in a bodyweight squat. You sit in a bodyweight squat, you keep your chest up and
why don't you show what that means? I don't know.
I don't know if you can see me.
Yeah, you can see
But
it.
say you get into a squat and can they see me?
Come forward a little bit more. There.
If you get into a squat and you're hunched over and you can't keep a neutral spine, you can't keep your chest up, one way to do this is to just find a wall.
So here's a wall. That should work.
You find the position where your hips are centered, center of mass is centered, your toes are slightly externally rotated, and you squat down into a squat.
Are you tucking under your pelvis a little bit and to keep it at a neutral?
Exactly. You tuck your pelvis a little bit. Chest up, back neutral, and you squat down.
So this is when I see athletes that do that, but they're not being careful. So they're mechanically able to do this, but they're still going out.
Yeah.
There's still too much extension here. So make sure you do a little bit of a tuck under to keep your pelvis at a neutral position, and you also need to keep your back. I guess the reason you do it against the wall is to keep your spine neutral.
Yes, exactly.
Which you can still not be neutral if you're not watching for it. So, the whole point of that is to keep the whole spine with no curvature in the lower back. So it's a squat. And one thing that I've noticed, at least I recommend, is not sometimes, almost always, with hip injuries, people have previous knee injuries. So a lot of times they can't do lunges or they can't do squatting because of the knee issue.
Yes.
So probably next month we'll do the knee, at which point we can do instead of lunging going forward, you go backwards, so you hinge on the hip. Yes. Of course that becomes a problem. We've got a hip problem and a knee problem.
Yeah. There's a lot of stuff that you would need to address.
There's so much to cover.
But so once I feel someone has kind of recovered that internal and external rotation in the hips, the next step, if we're dealing with anybody, but mainly athletes, we need to start to strengthen that position, because like I said before, if you have this newfound range of motion and you haven't mastered it and strengthened yourself through those ranges of motion, you're still just opening yourself up to injury. And so
I think that I want to make sure that we don't make this interview more for just athletes. Yes. So for active people, if you're rehabbing your hip joint and you're working on strengthening your inner, or watching out for your inner thigh, pulling your knees in, I'm going to grab a band here. So you want to do what John did, only you put this around your knees. And so the automatic thing, because it's against your knees, you're gonna be pushing against that to keep it in place as you're going down, keeping your back flat. So using one of these is a good idea.
Yeah.
To
Exactly. So using the band to kind of force your glute med and different structures to hold your feet, your hips into position. That's one way you could do it. It's definitely one way that I found that was introduced by me by a chiropractor in Northern California. I think his name is Dr. Shallow. One thing that the glute med that's a little misunderstood is that clamshells and things where the glute med exerts force, while they can produce results and while they do work, the glute med is mainly, it should be used as a stabilizer through these ranges of motion. So when we do monster walks, band walks, they work and they have a time and place, but when we're squatting, we want the glute med to be turned on without any external resistance. We want to be able to squat and not have to worry about firing our glutes. They should just be on to stabilize our hips.
So how do you do that?
So we have the chair here. One way
so this, by the way, is conditioning the area. So if you have an injury, you need to recover from that injury at a much lower level of rehab. Once you get to a point where you want to condition yourself to go back to whatever sports you are, or go back full force to where you were at before you injured yourself. And of course, this time you're going to be smarter because you know what to watch out for. Then that's what you're going to be doing.
So when we're squatting, we're in a bilateral position where we have double support. We have both our limbs on the ground, and when we squat, we may have deviations. We may have different things that we're not aware of because it seems natural to us. But with unilateral movements such as a single leg RDL or single leg squats or things of this nature, we're forced to stabilize ourselves laterally because we only have one base of support. So one way that I like to do this is a Bulgarian split squat, which is essentially just a rear foot elevated split squat. But most people, when they do it, they have 2 dumbbells and they're training for strength.
And they're going into extension.
Yes, which is a way to do it. But if we're mainly just trying to target the glute med and have it strengthen it to help us with external rotation, we want to offset the weight to kind of enforce that stability aspect while still getting a little bit of load. But load isn't the primary function. The primary function is to stabilize the hip. So it's a little more direct, if that makes sense. So we want to get a split stance position. Elevate our rear foot. Weight or dumbbell in the same hand that has the leg on the floor, and then you just squat. Squat down.
Keeping your back straight.
Back straight.
Neck straight too.
And come up. Your foot or your hip is going to want to cave in, and you want to consciously maintain that external position throughout the movement.
So just a little, you're so used to working with athletes, and I'm so used to working with people who are injured from athletics. So I want to kind of bring it down to simple terms for you to watch out for. Remember we talked about when it comes to hip mobility, it's very important to have stability. So stabilizers are your gluteus medius and minimus, which are here. They're really not for extension. They're to avoid the hips going in that direction. In orthopedics, we call that Trendelenburg. That's a positive Trendelenburg when you're walking up and down and your butt is going in that direction. I don't know, maybe some people find it sexy. I don't. I find it absolutely gluteus medius and minimus. So you want to avoid that because this needs to stay in place nice and strong, and when it's not strong, the load goes to here and it goes to there, and to some degree to your transverse abdominis. So you're really giving the work of this to other muscles who have their own jobs. So they're only going to get tired. They're not going to sustain your stability, and you're going to injure yourself. Pretty simple.
Yeah.
So when you're doing the exercise that John's talking about, or any exercise for that matter, don't be talking to people. Don't listen to music. This is your work. You pay attention. So pay attention to what you're doing.
Yes.
And as you're going down, like John had his leg against or up on the chair, make sure the leg that you're supporting leg You're not shifting your pelvis in that direction. You're keeping it nice and strong. As you're going down, you want to pay attention. Is my knee hurting? Am I contracting my psoas too much? Is my lumbar spine going out too much? The other thing that you need to be careful, your brain's going to give you what you're asking for. So at any cost. So the thing that you want to ask for, you need to be very detailed as to what you're asking for. You don't want to just squat. You want to squat with your neck in a neutral position, your lumbar spine in a neutral position. You want to make sure your pelvis doesn't go out. You're not popping your knee or anything like that. And you want to really hone down and pay attention to what part of you is working. And then communicate, if you're an athlete, communicate with your coach and say, you know, when I do this, this is what's happening. And then your coach, if he's John, I know he knows, is going to tell you exactly what you need to do. It's so much more fun to condition an individual who's right on with the biomechanics than to have to recover from the stupid injury.
Yeah,
really is.
Definitely. Yeah. One thing that me and the coaches and I at UCI talk about a lot is attention to detail. If you're looking for this specific adaptation and you're not, doing the movement right, if I give you this and tell you to do it, you're not paying attention, you're just going through the movement, we're both just wasting time.
Absolutely.
And so the attention to the details and what we want is the biggest part about all these movements, or else we're just, we're not doing anything productive. We're kind of just playing with weights. So
absolutely, and this goes, like I said, not just for athletes. I don't go to a gym. We have a farm. I don't need to go to a gym. It's called yard. But I see it on YouTube, and so many times I see these. I call them the gorillas. They're like walking around like that. They're giving advice, which is like, dude, you're not giving good advice here. So mechanically, it's easy to do it. Doing it correctly is what we're talking about. Yes. So you showed another one, the 90-90.
Oh yes, the 90-90. So let me go ahead and put this down. Going back to recovering that internal and external rotation. The 90-90 is basically a move that just puts you in both some degree of external and internal rotation at the hip, which is going to allow you to, tell your body, like, this is something that we need to explore. This is something that we need to get used to being in. I don't know if I'd say it would be more or less effective than, say a Bulgarian split squat or something loaded, because when we're squatting, we have a load on our back. We're not, on the ground. We have 2 points of contact. So what we want to move from a position that's less specific to what we want to get to more specific. So with the 90-90, it's a good way to, if you've never done it, definitely do it. It's going to tell you, like, train your brain, your nervous system that, hey, this is something we need to explore, this is something we need to get used to, and then move to, something that's going to be a little more specific to squatting. But this is definitely a good first step into that direction. So,
of course, if you have a tight psoas, that's going to be a problem.
Exactly. So, can they see me on the ground?
Oh yes, let me just go back here. Sorry. Let me see if I can bring this down a little bit. Is that good? I think it is.
Yeah. So, with the 90-90, this is something that I do probably every day. I've done it for about a year, and I still suck at it. I still have a lot of work to do through this range of motion, because I was so regressed that, this needs to become like normal and easy, which it's not yet. So I'm still working towards it. So for the 90-90, if I'm facing you, it's almost like a modified pigeon stretch. So one leg
is 90 degrees. Which I see with a pigeon stretch, I see a lot of performance injury.
Yes. So it's called the 90-90 because one leg is at 90 degrees, while the other leg is at 90 degrees. And so one hip external rotated, one hip internally rotated. So with this, you're gonna feel things you probably have not felt before if you've never
like
been
your psoas
in this position. You might cramp. You might, when I first started, I couldn't sit in this position. I couldn't get to my torso being upright, and it's still not very upright. I'm still a little biased to one side. You should be able to get into this position and hold yourself up. I still can't do it because I'm still working towards it.
Let's see if I can. I'm gonna be so busted. Holy moly! I don't know if I can stretch like that. Of course, I've got an excuse. I did fracture my acetabulum. You know the story, right?
I did not know that.
Yeah, I fell off my horse and I basically shattered my acetabulum here. This is not easy. My psoas is, my sartorius is, everything. This is a good exercise. Now
Yeah.
I'm going to be going that way. Whatever you do, do not force it
Yes. Don't.
because you're going to just hurt yourself.
Yeah. So, like we said before, we need active solutions. We need to be active in this position. I can't. If I just sit here, do whatever, I'm not really doing much. But if we focus on keeping ourselves upright, keeping and maintaining our position, we'd get more results than just sitting here because we're just wasting time. Once you get accustomed to this position, you switch, you go to the other side.
Just you make it so easy.
Huh?
You make it look so easy.
No. You can switch to go to the other side, and you get yourself a little more upright, and then you can start exploring, different ranges of motion through this position. So you can, lean over, get a little more stretch on your glute med. You can, reach to the side, get a little rotation. There's different things you can do within this position, but I know for me, myself, I still need to work on getting more upright in this position because I'm still super tight, especially on this left side of my
But
pelvis.
I question if you'll be able to ever be sitting like in this because of the fact that your pelvis is tilted. So there is some degree of lateral flexion
Yes.
anyway
Yeah.
that is going to be inherent to the move.
Yeah, exactly, but you especially if you see some of the athletes that we have at UCI get in this position, they'll get here and they'll be able to do there's a ton of stuff you can explore through this position, which is just going to help you maintain more external and external rotation when you're doing other things such as your sport.
So one thing that I want to bring onto your attention is that I have seen people doing this with a kettlebell, as if this position and not being in the right position doing it. So you don't want to be in the wrong position and loading your joint up. I mean, just because it's almost like going to a yoga class where you hardly can stretch your muscles, and then you see the yoga instructor that, you wonder if there's any bones in their body because they're so limber, and then you start doing these things and you're going to end up hurting yourself. So be smart. Pay attention.
Yeah, definitely know your limitations, what you can and can't do, and what you need to work towards.
Very good. Do I need to bring this up now?
Yeah.
All right, let's see if we can do this and see John's head, and here we go.
Okay.
Hey, Pablo, I see you there. Pablo played water polo there, and you've got a whole bunch of people who are apparently watching us, according to Facebook. So the point here, one thing I'm not so sure if you guys ever talk about pelvic floor. That's the one thing that is totally missing in the whole realm of active people, athletes or not. And pelvic floor is basically your diaphragm here, the pelvic diaphragm, and your actual diaphragm up here, which everyone knows about. The health of these being parallel to each other and really tossing that air, playing volleyball back and forth, is so important in the health of your core. Core is so misunderstood because everyone thinks your core is pretty much your abdominal muscle and your lower back, when in reality your core is your axial line, so the midline. So if you build the midline properly, then there's only so far you can go because your midline is going to keep you in place, and that's what it boils down to. So I want to just kind of throw in that teaser, so there's a lot of things to remember and to actually make sure it's in place before you're able to condition something. And remember, conditioning is not rehabbing. Rehabbing, well, it is kind of the later stage of rehabbing is, or preparing to go into a sports or having a performance without really injuring yourself. So you got to do the preliminary work before you can really up the load and the performance there.
Yes.
This is a good exercise, and I had no idea I couldn't do that. I
Yeah,
don't know how I feel about you anymore.
It's definitely a tough one. Being in that position, having your hips like that, I mean, it's a good bang for your buck. movement where you can either get a lot out of it, or like we said earlier, you can just sit there and kind of just waste time. But it's definitely something everybody should at least see if you can get in that position. If you can, well, hey, you're probably ahead of most people. If you can't, you know where you need to start and where you need to go from.
I think a good, we'll probably have to wrap it up here, but a very good thing to keep in mind, and no matter what place of positioning you have as far as how active you are, how many years or how well you perform your sports, keeping, doing the very basic conditioning of your body is extremely important, hip joint or not. And I think the best exercise is really holding the squat, keeping the neck in a neutral, and keeping your whole back straight. The best way to do it, and I don't know how practical it is to do it on your own, is to actually get a PVC rod or a stick, and you really put it in the back of your head, and the other end is at your spine. And as you're squatting down, and I do like having my feet out a little bit for that centration purpose. So as you're going down, you're going to do a slight tuck under, engaging your pelvic floor, which you may or may not know what that means. It is on my YouTube channel in case you want to check it out. But you want to make sure that you hinge the hip back behind the knee as you go down. You can do this. Keep this down, tuck under. That is a workout. Holding that pose is a workout. And no matter where you're at, you should do this, I think, on a daily basis.
Yeah, a lot of these movements would benefit you more to do them on a daily basis, because we're doing so many things that, you know, maybe are counterproductive, such as, you know, everybody says this all the time, but sitting. I mean, sitting is as bad as everybody makes it out to be. It is not good to sit down in that flex anterior position, you know, for 10 plus hours of the day. And because it's such a big part of our day, we need to have something to help us combat that, or help us get out of that position and recover. So, you know, some of that extension, some of that external rotation, all the things that we've been losing by sitting so much.
Very true. And one thing I have to mention here, no matter what, is you have to understand your brain sends the command to your body parts. So you may be conditioning your body parts. In this case, we're talking about their hip, but you have to understand when you deviate from the normal pattern of movement, that impacts the command center, your brain, and how it sends the command. We're talking about tracking, nerve tracking, neurologic tracking, all that's jazz. So you have to make sure, just like you're conditioning and working out your actual specific body parts and joints, you have to go back to the part of the brain in charge of that movement and make sure that's intact, which it is. It just starts shrinking if you don't use it. So we're talking about forward flexion, the part of your brain called PMRF, pontomedullary reticular formation, in the middle portion of your brain that says upright against gravity, doesn't get to win because all day you're sitting like that, so it starts shrinking. So you have to understand there are exercises to do for that. So really, no matter what sports you're playing, how active you are, that's the part of your day that you need to be concentrating on. I don't want to turn this into a posture neurology, but you have to understand what the whole picture looks like, what the truth is, and then understand each body part as we go through for the next 12 months.
Yes.
Right on, brother. Thanks for watching, and I'll be putting this on YouTube, and this guy is just awesome. I love him. You guys take care.